So I want to touch on the idea of the point of stain. This is something that was brought up from Lynette Zanders. I took a class of hers probably a year ago. And this concept of the point of stain comes actually from an ad campaign that Tide Laundry did back 20, 30 years ago. And the word or definition of point of stain is the moment that a possible consumer thinks of your product. For Tide, that is, no one is sitting at home thinking about what detergent that they want on a regular basis. But the moment that they spill something on their shirt, or the moment that they spill something on their tablecloth or their curtains or whatever it is in their house, that's when they think, oh no, I need to use a laundry detergent. I wonder which one I should use, or potentially that's what has influenced the one that they bought and that's sitting on their washer. So for an oral surgeon, keep in mind, using that analogy, people are not sitting at home thinking about what oral surgeon is really great in their town, or who should I have take out my wisdom teeth when I get them. Those questions don't come up until the patient is in the chair at the dentist, and most likely what happens is the dentist has just taken x-rays and they're reviewing the x-rays with the patient. They look at the x-ray and say, oh, I can see you've got a third molar up here that's going to need to get taken out. It looks like it's a little more it's going to be a little more challenging than something I can do, so I'm going to need to refer you to an oral surgeon to have this taken out. And the patient will then say, as they have for 20 to 30 years, who do you recommend? Who should I go to? Which specialist do you recommend for this particular procedure? And the dentist at that point is the moment where you need to make sure your name is mentioned. And they will say, I recommend going to Dr. Johnson or Dr. Stevenson, both great doctors, fantastic oral surgeons. I've been sending patients to them for years. You can't go wrong. If you are not mentioned at that point in the conversation, the problem is not your marketing and not the how much money you're spending on Google AdWords. The problem is that you don't know the dentists in your town well enough, and you need to go start developing those relationships. But assuming that you do have dentists in your town that are bringing you up in conversation, the next thing you need to consider is what happens next. When the patient leaves the office, they go home, and then they're going to go to their computer and they're going to research your business or the two doctors' names that were referenced. And they may also search for other dentists or other oral surgeons that are in that area. Keep in mind, this is not what it was like 15 years ago. 15 years ago, the dentist would say, I'd recommend going to Dr. Stevenson or Dr. Johnson. And the patient would have gone home, picked up the phone, called both of the doctors and looked at pricing, maybe which one could get them in the soonest, and they would select one of those. In today's world, the way that people are finding and making those decisions is changing because it's too easy for me to pick up my phone and I can immediately pull my phone and say, hey, oral surgeons in my area, and I can find all the listed ones on Google. I can see what their ranking is. I can see how many reviews they have. Then I go to their website. I can see if it looks current, if it looks modern. I want to go to someone that I can trust that's going to do a good job. And then the next thing is, are they available? And can I make that work? But that's the journey that patients are making now. The point of stain is when they're in the dentist's office, and that's what makes you a referral-based business. But after they leave that, they're then going into a place where they're doing their own research. They're crowdsourcing that knowledge and that information, and then they're going to pick up the phone and call you after you've passed all of the little tests that they're mentally putting your office through. And that's why oral surgeons do need marketing. They just need a different type of marketing than dentists do.